We are now into the month of February, and of course, this is American Heart Month. This is a time to raise awareness as heart disease continues to be our nation's #1 killer. We're here at Advanced Medicine and Aesthetics, and we've got Brooke Bentley here with us, and certainly when it comes to the numbers, continuing to see the same type of story.
Yes, heart disease is the leading cause of death for both men and women in the United States. 1 in 4 deaths are caused by heart disease each year, and those numbers are just huge. The good news is that heart disease can be preventable if people make healthy lifestyle choices and manage their health conditions. So this month, we just want to raise awareness on how you can prevent heart disease.
And like you said, of course, there are things like genetics that we can't change, but there are a lot of things that we can do.
Yeah, so a few things that we can work on this month. First, I would recommend that everyone make an appointment with their primary physician and just schedule to talk about heart health. Ask what you can do to prevent heart disease. Ask which blood levels and tests that you might want to have. Some of the common tests that we look at here are lipid panels, C-reactive protein, and the Boston Heart Test is always a great test to look.
And there are some things that we can do to sort of maybe tweak our lifestyle a little bit that can help as well.
Yes, exercise is a huge one. There's tons of studies out there on heart health and exercise, and the prevailing report is always the more active you are, the less likely you are to develop coronary heart disease. So we all need to exercise and get moving. Taking steps to quit smoking. Smoking is a huge risk factor when it comes to heart disease. Taking your medications on time and not skipping doses. It's so important that we take our medications daily that are prescribed for hypertension, for high cholesterol, any blood thinners you might be on, or aspirin if it's recommended. So just little things that we can do each day to make a difference.
And of course, our diet also plays a big role, and you guys are always recommending a real healthy diet.
Yes, you know, clean eating is so important, and it's not only going to help with your heart health, but it's also going to make you feel better.
Yeah. And then you mentioned some of the tests that you can do, and I know a couple of years back I did that Boston Heart Panel, and that really gives you a nice look at what's going on inside your body.
It's a great test. The Boston Heart has developed a test that is a specialized blood test that breaks it down pretty much into 4 categories: lipids, inflammation, genetics, and then metabolics. And so it's a great test that gives us a look at your heart health risk, and it really helps us to choose what medications are great for you, if you need any, you know, the overall disease risk factors that you have going on, and it helps us develop a treatment plan and develop a lifestyle plan that's going to help you meet your heart health goals.
And if I remember correctly, it was a pretty easy test. I think there is some fasting.
Yes, you do have to fast. It's a blood test, and most health insurance carriers cover the test, so it's great, and you have a lot of information that test gives you.
And we know certainly that information is key when it comes to being able to really know what's going on inside your body.
Yes, and being proactive about your health.
All right. Well, Brooke, thanks so much for having us out. Some great information. Again, don't forget, it is American Heart Month. You can stop by Advanced Medicine and Aesthetics right here in Johnson City to learn more about that Boston Heart Panel.
The preceding portion of Daytime was sponsored by